We must realize that we started from zero. There was no hospital. We had to plan the hospital. And having planned the hospital, we have to put it up. We have to deal with the engineers and the architects. And then we had to plan for staffing the hospital. Further, we had to equip the hospital with the proper equipment to run the hospital. It's quite a feat. That's why we invited the specialists from various colleges of medicine, medical centers, and hospitals to help us plan this together. They must first of all love the Philippines. And loving the Philippines, they love the Filipino patients. And that having that love for the Filipino patients, that they would stay for many, many more years after training in the Philippines and apply their knowledge to the Filipino patient. There's no need for convincing. It's a project that is good for the country, and the doctors welcome it.
So government service is, for me, very important. It's a chance for you to give back to the community. Also, I felt that our people, the public, they deserve the best. They deserve the best people. They deserve the best services. They deserve the best hospital. And when you get into administration, you have a role, no, in contributing to that. You know, perhaps one of the highest requirements of service is my own family. And, you know, I had to have a hospital that was good enough so that when my family members get sick, they'll want to stay here in NKTI. So, I feel that when you work in government, you have a role to play which will impact not only yourself, not only the patient you are treating in front of you, but the Filipino people.
Well, it has been 30 years of public service, and up to now, I'm still very passionate to serve this institution, which has honed me to become a better individual, personally and professionally.
So it's been such an eye-opener that one government facility could provide you the best of worlds, the best for being in a private setting, at the same time be able to fulfill what government should provide for its people. So NKTI became my main base. I never looked back, and I never regretted making NKTI solely my main base of operation. It wasn't a difficult choice. You grow on it, virtually roots grow on you, and become part of an institution. That's the least I could say.
First and foremost is the leadership. We have empowered our leaders for NKTI to become recognized locally and internationally. We have the Civil Service Awards, we have awards from the Presidential Office, you know, and of course the international awards with the Healthcare Asia. We have expanded our bed capacity to serve more service cases, and of course expansion of our patient care and management. And most of all, I believe, is the infrastructure that you have now seen at NKTI. We have the renovations inside the hospital, and also this peritoneal dialysis warehouse, and soon to rise will be the medical arts building, the outpatient building, and in the 5,000 square meters area, wherein we have ejected the illegal settlers. Soon to rise there will be the hemodialysis building, which will house 220 stations.
Yeah, for me, I see NKTI in the next few years that it would expand its services to the regions. We'll have our regional NKTI satellite centers in which we will have in major regions like in Northern Luzon, Southern Luzon, Visayas, and Mindanao. And aside from that, we will have more a community-based renal health program in which we will be collaborating with other stakeholders. So we will not be confined within the hospital. We will be extending our services to the community.
Well, my message to our patients, I hope that they continue to patronize and trust the healthcare services of NKTI. For the employees, I hope that they will continue to be loyal, to serve NKTI with compassion, empathy, and excellence. And of course, to our future leaders in NKTI, may they continue to be the role model and keep the enthusiasm to lead, learn, and share their experiences and expertise with the next generation to come.
I want every one of our staff to know that they represent NKTI. And always, when we present ourselves to the public, we put our best foot forwards. We show to them our best. We show to them our excellent service.
As an Apex Center, NKTI will be serving more patients with the rollout of the universal healthcare. We are here to uphold our mission and vision. To our employees, you are the heroes within this hospital. You will be protected, and you will be, with your great efforts in this hospital, you will be commensurated. You are the future of NKTI. Keep that dynamic flow of blood within you. And of course, keep shining and keep rising towards the golden year of the NKTI.
I witnessed the first admission and discharge ng pasyente in 1982 with our limited service beds. I processed and signed the first disbursement voucher NKTI ever transacted. In 40 years, NKTI pursued to expand its operations to continuously serve our poor patients afflicted with kidney and allied diseases. Look at NKTI now. And I believe this noble mission shall continue not only in the next 5 years, but as long as the name National Kidney and Transplant Institute exists. Happy 40th anniversary to all of us.